Good morning students. Today we are going to discuss about Civics chapter 2, Role of the Government in Health. Students, in this class we will be discussing government, health, healthcare facilities in India, etc. First of all students, we are going to discuss about government. Students, what do you mean by government? As a government is the system. See, it is the system to govern a state or community. Students, a government is a group of people that have the power to rule a territory. As territory refers area or region or country. Students, see, governments make laws, rules and regulations, collect taxes, etc. These are the responsibilities of government. As what do you mean by government, students? Yes, a government is the system to govern a state or community. Is it clear, students? As moving on to understand health. Students, health refers the state of being free from illness and injuries. See, a person's mental or physical condition refers the health. Simply we can say health means our ability to remain free of illness and injuries. Is it clear? Okay. What do you mean by health? As health means our ability to remain free from illness and injuries. Students, next we are going to discuss about what are the factors affect our health. See, we need to think of other factors that affect our health. For example, if we get clean drinking water or we live in a polluted free environment, they are healthy. But if people do not get adequate food to eat or they live in slum area, they will be prone to illness. Am I right, students? What do you mean by slum area? As slum area is a dirty place. So, we all need to be without mental stress. Next, we are discuss about healthcare in India. Students, in this topic, we will be discussing positive aspects and negative aspects about healthcare system in India. Students, we will see positive aspects healthcare in India. India has the largest number of medical colleges. That means 15,000 new doctors qualified every year. So, this is another one positive aspects of healthcare in India. Now, we are going to discuss about number of hospital in India. See students, in 1950 there were 2717 hospitals in India. But as per the data of 1991, there were 11,174 hospitals in India. At the same time, in 2000, we have 18,218 hospital, and in 2018 there were 35,416 hospitals in India. See students, in this data, what do you think? Yes, you are a brilliant students. You know very well number of hospitals increasing. Students, it is increasing or decreasing? Yes, you are absolutely correct. It is increasing. So, this also one of the positive aspects of healthcare system in India. Next students, you know very well, India gets a large number of medical tourists from many countries. What do you mean by medical tourist? Yes, that means a person or group of people who come to our country for medical treatment are known as medical tourist. So, India gets a large number of medical tourists from many countries. Hence, you know, India is the fourth largest producer of medicines in the world. So, we have lot of positive aspects in the healthcare system of India. Hence, I will give you one home assignment. Anybody guess the home assignment? It's very simple students. So, what is your work means? You know very well, India is the fourth largest producer of medicine. Just you say who occupy the first place and who occupy the second place, finally who occupy the third place. Definitely you should find students. Am I right? Because you are a very brilliant students. I trust you. This is your work students. So, we discussed positive aspects about healthcare system in India. Till now, we saw a lot of positive aspects regarding healthcare in India. At the same time, various negative aspects also healthcare in India. Here, negative aspects means lagging positive, such as most of the doctors wants practice in urban area. Hence, people in rural areas not possible to get doctor's consultation at all time. Students generally in rural area frequent transport facilities not available. Am I right students? But people in rural area have to travel long distances to reach a doctor. Students, already I told you, most doctors wants practice and settled in urban areas. So, the number of doctors with respect to the population much less in rural areas. Yes, students, in rural area, doctors and population ratio is very least. Students, here we think lot of people die from tuberculosis. Students, did you know tuberculosis is a global pandemic like coronavirus? About 5 lakh people die from tuberculosis every year. Yes, students, similarly, 2 million cases of malaria are reported every year. Another major negative aspect is we are not able to provide clean drinking water at all. Important report is 21% of all communicable diseases are waterborne diseases. For example, diarrhea, worms, hepatitis, etc. Students, half of all children in India do not get adequate food to eat. Students, now I think you understood positive aspects and negative aspects of healthcare in India. We need healthcare facilities to maintain good health. In order to prevent diseases, we need healthcare facilities. What are the healthcare facilities, students? Yes, healthcare facilities includes health centers, hospitals, ambulance services, blood bank, etc. At the same time, we need health worker, nurses, qualified doctors, and we also need the medicines and equipments that are necessary for treating patients. These facilities are required to take care of us. In a democratic government, expectation of the people that government for the welfare through the provision of education, health, employment, etc. Students, now we are going to see the story of Hakim Sheikh. Hakim Sheikh was a member of the Pashim Bangaket Mazdoor Samiti, an organization of agricultural laborers in West Bengal. My dear students, the story of Hakim Sheikh goes back to an evening in 1992 when he was traveling on a train and fell down from a running train. He suffered massive injuries on his head due to the fall. When he was rushed to the hospital in Kolkata, he was denied treatment due to a lack of bed availability. Another hospital did not have the facility or the specialized doctors need for his treatment. In this way, he spent 14 hours in a critical state and was taken to 8 different government hospitals. Hospitals refused to admit him. Students, can you guess what is the reason? Because they did not have a spare bed. Students, at last, Hakim Sheikh was admitted in a private hospital where he received treatment. He spent a huge money on his treatment. Students, I hope you understood the story about Hakim Sheikh. Students, before we are going to see the categories of healthcare facilities, you must know about the meaning of healthcare facilities. That means health facilities are places that provide healthcare. They include hospitals, clinics, outpatient care centers, specialized care centers, and also primary healthcare centers. Now, coming on to the categories of the healthcare facilities. First one is public health services and another one is private health facilities. Public health services. What do you mean by public health services? Yes, the public health services is a chain of health centers and hospitals run by the government. They are linked together so that they cover both rural and urban areas. That is, at the village level, there are health centers where there is a nurse and a village health worker. Students, they are trained in dealing with common illness and work under the supervision of doctors at the PHC. What is mean by PHC, students? Yes, it is primary health center. Okay, students, such a center covers a village in a rural area. After that, now we will see district level hospital. There is a district hospital that supervises all the health centers. Finally, large cities have many government hospitals and also specialized government hospitals. Students, what is public? Yes, the health service is called public. It has many reasons mentioned. First of all, the government has established hospitals and health centers for everyone. The second one is the medical facilities are provided at a low cost so that students, the poor, can also get treatment in public health services. Now we will see the function of public health services. What is meant by public health services? Yes, the public health services to take action to prevent the spread of diseases such as TB. Students, already I told you what is meant by TB. Just you guess it? Yes, TB is a tuberculosis. After that, malaria, jaundice, cholera, diarrhea, chikungunya, etc. These are all the public health services. Now we will see private health facilities. Yes, there is a wide range of private health facilities that exist in our country. There are hospitals and nursing homes that are privately owned. Private health facilities are not owned or controlled by the government. Students, patients have to pay a lot of money for every service that they use in private health facilities. Students, now we recall this topic, public and private healthcare services. Public health services means is a chain of health centers and hospitals run by the government. One important aspect of public health is that it is meant to provide equality healthcare services either free or at a low cost so that even the poor can also get treatment. It is available in both the rural and urban area. But in private health services are not owned or controlled by the government. People have to pay lot of money for every service that they use. These are the difference of private and public health services. In private health facilities, what is meant by RMP? RMP is nothing but registered medical practitioners. Okay, students, urban areas have a large number of doctors, many of them providing specialized services. There are many special facilities such as X-ray, ultrasound, etc. There are also shops from where we buy medicines. Today, private facilities can be seen all around. In fact, there are large companies that run hospitals and some are engaged in manufacturing and selling medicines. Students, now we will recall public health services and private health facilities. What is meant by public health services? S. Public health services is a chain of health centers and hospitals run by the government. One important aspect of public health is that it means to provide quality healthcare services either free or at a low cost so that even the poor can get treatment. it's available in both area. That means rural area and urban area. What do you mean by private health services? Students, private health services are not owned or controlled by the government. People have to pay a lot of money for every service for their use. Students, these are all the private and public health services. Students, next we see the topic about healthcare and equality. It means in India, private health services are increasing, but public health services are not. The cost of these private services is high. Many people cannot afford them. Hence, that means private services are increasing fast, but public services are the same. There is no increase in the public service. So, people have access to mainly private services. The cost of private services is very high. Some private services encourage incorrect practices to earn more money. Students, private services sometimes encourage practice which is unethical. 20% of Indian population can afford medicines that they require during an illness. It is the responsibility of the government to provide quality healthcare services to all its citizens. Students, in these situations, what can be done? Students, you are correct. It's the responsibility of the government to provide quality healthcare services to all its citizens, especially the poor. It's important to work on public health facilities as well as an basic amenities in order to improve the health situation of our health. Let us take two examples to understand this in a better way. One is the Kerala experience. Another one is the Costa Rican approach. Students, now we are seeing the Kerala experience. In 1996, the Kerala government allocated 40% of the total Kerala budget to the panchayats. Students, this made it possible for a village to make sure that proper planning was done for water, food, women's development and education. Health centers were also improved. They could plan and provide for their requirements. The working of schools and Anganwadis was ensured. Students, let us see an example of another country and its approach to issues of health. That is, the Costa Rican approach. Students, Costa Rica is considered to be one of the healthiest countries in Central America. Costa Rican is located in South America. Several years ago, Costa Rica took a decision not to have an army. This helped the Costa Rican government to spend the money that the army would have to used on health, education and other basic needs of the people. The Costa Rican government provides basic services and amenities to all Costa Ricans. For example, it provides safe drinking water, sanitation, nutrition, and housing. Finally, they approach knowledge about health is an essential part of education at all levels. Students, next we are seeing recall the topics. Students, What do you mean by health? Yes. Health means our ability to remain free of illness and injuries. Apart from disease, we need to think of other factors such as clean drinking water, pollution free surroundings, etc., that affect our health. Students, adequate food is also essential for keeping ourselves in good health. Students, keep in your mind a life with stress will lead us to illness. So please don't be tense. Keep smile, keep on smile. Hence, we need to be without mental strain. We need proper healthcare facilities to maintain good health. Students, next one is healthcare facilities. That means healthcare facilities include health centers, hospitals, ambulance services, blood banks, etc. In order to run such facilities, we need health workers, nurses, qualified doctors, etc. Students, now I am asking to you one question. What do you mean by medical tourist? Can you say anyone? Yes. The foreigners who come to our country for medical treatment at hospitals that change the reasonable cost. It's called as medical tourist. Next one is healthcare in India. In positive aspects, India has the fourth largest producer of medicines in the world and is also a large exporter of medicines. After that, healthcare facilities can be divided into two categories. First one is public health services and private health facilities. What do you mean by public health services? Yes, the public health service is a chain of health centers and hospitals run by the government. It's found in both the rural and urban areas. Second one is private health facilities. It means at the village level there are health centers where there is usually a nurse and a village health worker. They deal with common illness. At the district level is the district hospital that supervises all the health centers. In big cities only have many government hospitals. Under the public health system, quality healthcare services are provided either free or at a low cost so that even the poor can get treatment. Under this system, the action is also taken to prevent the spread of diseases like tuberculosis, malaria, jaundice, diarrhea, chikungunya, etc. Students, what do you mean by communicable disease? Yes, a communicable disease that spread from one person to another through water, food, air, etc. Students, you know what is OPD? Yes, it refers to the outpatient department. Next one is what is meant by RMPS? Yes, it refers to registered medical practitioners. They are found in rural areas. Finally, the Kerala experience. Kerala has made efforts to provide adequate health care to people of the state. Moving on to understand Costa Rica. Yes, students, Costa Rica is a country in North America. It is considered to be one of the healthiest countries in the continent. Students, all of you take your book, read the lesson line by line. It's very easiest and interesting lesson, students. So read the lesson carefully, students. Thank you, students.